Hi, I'm Phaedra Kress, Executive Editor of the Aesthetic Surgery Journal, and I'm here today with my colleague Hunter Alexander, who is the Editorial Manager of the journal. We're here today to talk to you about some of the trials and tribulations of peer review, what you can do to improve your manuscript for submission, and even throughout the actual peer review process.
Yes, after an article undergoes peer review, it comes to me to formulate the decision letter. And Phaedra and I have recently noticed that many of the same formatting points are being returned to the author. So we thought it'd be helpful to go through some of the points we've been repeating in many of our decision letters to get it out there what we are expecting authors to have in their article outside of the scientific content, which is judged by the reviewers and editors. So starting with the method section, first we need to find out how the patients were chosen for the study. Were they consecutive or were inclusion-exclusion criteria utilized? Was any form of randomization utilized? If so, you need to describe how the patients were randomized into X number of groups. Was a computer program used? Was a spreadsheet? Was it Microsoft Excel? What type of randomization? That needs to be clarified in the method section. Was the study IRB approved? If not, was informed written consent provided by all the patients? Was the Declaration of Helsinki guidelines followed? Was patient satisfaction assessed in any way? If so, did you use a validated survey? Was an interview format used? Who conducted the interview? Was it done phone call, email, snail mail? Were the patients anonymously contacted or did they identify themselves in any way? We basically need to find out how the study was conducted in the method section and when it was conducted. What was the date range of the study? Moving to the results section, then we get into patient demographics. Number of males, females in the study, age range, mean age, if BMI is relevant in any way to the study, mean BMI, BMI range, and then if any sort of satisfaction assessment was conducted, this is where you put the results of that. It's usually helpful to put that in tabular form as a table. If not, describe them in the text. Moving then to the discussion, we need to find out how this study enhances the literature on the topic. What's the importance of the study? And then also, just as important, what are some of the limitations? What would you do differently if you had to do the study again in the future? What are the implications for future research? Then we wrap up with a conclusion section, which should be pretty brief. Basically, you're putting the take-home points here, a brief summary of the study, and summarize your points. So then that goes through a few bullet points of what should and should not be in each section. There's a few other elements that are required for papers to be published in ASJ. If a patient is recognizable in any way, not only a facial photo or a photo of someone's eyes, we're going to need a signed consent form, and that includes if a patient has recognizable tattoos, if he or she is wearing jewelry that could be recognized, birthmarks, anything like that. The figure legend, we need a detailed description of all the photos, not just pre-post photos, also inter-op, the patient's age, gender, the procedure he or she underwent, and then also the follow-up time, when were the post-ops taken. All that info needs to be in the figure legend. And then, if possible, it's really helpful to provide a technique video. After reading your article, a reader should be able to reproduce the technique in his or her clinic. So the inclusion of a technique video is really, really helpful, and our readers do appreciate it. Technique videos should include English, either subtitles or narration. We prefer narration, but if that's not possible, by all means include English language subtitles on your video. So that covers a lot of points. I hope that wasn't too much. What should be in each section, and then a few other elements to really enhance the quality of your article and increase the